In tonight's Medical Watch, it's a common repair for athletes of all abilities. ACL reconstruction. Surgeons are always upping their game when it comes to technique, and that means patients get the win.
There are many activities that people engage in that get them into trouble with their knees, and specifically this injury.
An anterior cruciate ligament, or ACL tear. It's an injury orthopedic surgeon Dr. Mark Bowen sees in all age groups and at all levels of activity and athleticism.
Probably the most visible are the sports that involve a lot of cutting and twisting, like soccer and basketball, football.
It was a flag football game that took out Billy Delacoris, his second ACL tear in the same knee.
I planted my left foot, very familiar feeling. Bottom leg goes one way, top goes the other way. I felt a very small pop.
It's a torque, and the upper bone rotates aggressively on the lower bone.
Patients have a few choices when it comes to reconstructing the torn ligament. They can opt to use part of their own patella tendon, which requires a larger incision in the knee, or a donor graft, a tendon taken from a cadaver.
The advantage of somebody tissue from outside, from a donor, is that it is taken out of a freezer thawed and put in your knee. And so the incisions and the trauma to your knee are absolutely the least. The disadvantage, unfortunately, is the re-tear rate. It's probably as high as 10 to 20% in cadaver grafts.
That's why the hamstring, and a novel way of attaching it in the knee, is so appealing to Dr. Bowen.
It has less trauma than using the patella tendon, yet it's your own tissue.
After his first tear, Billy opted for a donor graft. This time around, he took a different path.
I listened to his advice, and it was a drastic difference.
First, Dr. Bowen makes a small incision to access the hamstring, the same incision he uses later in the operation to attach the graft. The hamstring graft is like a long noodle, about 12 inches in length.
And the key features of the technique were to take only one hamstring and quadruple it, so make it the thickness of 4, and it's actually stronger than the patella tendon. What hasn't been as strong is the fixing of it, but this is.
This is the widget Dr. Bowen uses to prep the tendon for fixation. He wraps the hamstring around 2 posts 4 times, then sews it together to close the loop.
That allows us to pull these tapes out.
He stretches the graft to remove any slack.
It's totally not pulling apart, under a lot of tension. And the reason is the pulley effect, because the load is distributed continuously in those loops.
Inside the knee, he anchors the tapes to the bones.
This has gone in the knee, down into the tibia, and up into the femur, and then this screw embeds the tape in the bone. Let's just look at your range.
It felt like I was stable and stronger quicker, and I was able to go through the hurdles and the progress in my rehab a lot sooner and faster this way around. I mean, it really was night and day.
Dr. Bowen says the re-tear rate with his hamstring procedure is 1 to 2%, as good as prior options. If you'd like to learn more, go to our website, WGNTV.com. Back to you.
Thank you, Dina.